James O'Brien, who is a very interesting fellow from LBC, brings up the question about whether or not Rishi Sunak, who has private health care, can actually appreciate the rigours and the problems that the NHS is in, and therefore is he the right person to help drive the NHS forward through this century? The answer, I would say, is emphatically yes, and why. In Scotland, there's already been a pitch that people who can pay for their treatment on the NHS should. And I'm suggesting that opportunity already exists, but it's not properly integrated in the system. So if you pay for private healthcare, the chances are that that private healthcare will only deal with one or two small issues. And if there's a problem, you're shunted back off into the National Health Service system. What we need is a really efficient private healthcare and a really efficient National Health Service. And we need the two things to be working together rather than competing with one another. They are literally working together, because many of the consultants in the NHS are moonlighting in the private healthcare system because the private healthcare is going to pay them more for doing actually what they're already doing. So why it makes no sense for them not to do that. But they're exhausted. They're exhausted because the NHS demands so many hours from people and cannot pay the sort of rates that private healthcare can pay. I think people who can pay should pay. And that needs to be written into the understanding, not necessarily a legal understanding, but a moral understanding of how we deal with our healthcare. And there are so many things which the National Health Service does incredibly well. I wouldn't be here without the National Health Service today. I was wheeled in very quickly with emergency surgery about a year ago because I started to hemorrhage suddenly. And I had T3 cancer. I had very speedy surgery for colon cancer. I'm now rather proud. I'm now the proud owner of a semicolon. But at the same time, I also had to have blood work because I suffer from haemophilia. And no private healthcare system would actually deal with all that complexity, but it should. If I can pay, I ought to pay. I ought to be able to control that level of healthcare if I can pay. And that would take the strain off the NHS. It's not about not supporting the NHS. It's about taking the strain off the NHS. If you can pay, you should pay, and you should be using the private healthcare systems if they will work for you. So can Rishi Sunak deal with the NHS if he's not actually using the NHS? Absolutely. Absolutely. And we need to get rid of all this nonsensical pseudo-religious claptrap that suggests that if you're not actually using the NHS, you're not able to understand the NHS. Most of us, God willing, do not use the NHS very often. We only use the NHS when we are ill. So are you suggesting that somebody who is healthy cannot help the NHS? What utter rubbish. Only people who are ill and struggling in bed in hospital can help the NHS? Rubbish. We need to take the pressure off the NHS. If we can pay, we should pay. I'm sure there'll be many comments.